While many cases of depression will require medical intervention, such as therapy and medication, there are daily changes that anyone with depression will benefit from. In this video, we'll talk about 2 basic concepts in dealing with your depression that should be part of any treatment plan for depression. Stay tuned. Hey guys, my name is Dr. Brendan Rowe. This is Real Talk Mental Health in Vancouver, Washington, where we talk about real-life mental health issues from a medical provider's perspective. If this is your first time to our channel, be sure to check out our videos, and if this is something that you're interested in, be sure to hit the subscribe button and tap the notification bell. So let's dive in. Major depression is a complex illness that often requires medical intervention in the form of prescribed medication, therapy, or even TMS. However, overcoming depression is so much more than just complying with prescribed treatments. There are a few steps you can take to ease depression severity and improve your odds of achieving full remission of symptoms. Over time, consistently implementing a few behavior modifications can go a long way in helping you feel so much better. That's not to say that you can just snap out of depression. Today, I'm going to focus on 2 essential concepts in beating depression that are helpful in both mild, short-term cases of depression, as well as chronic, severe cases, and should be a part of every plan to beat depression. First, help yourself out and be proactive in fighting against the symptoms of depression. That's not easy. It'll take consistent effort on your part to make these changes. But what you need to understand that is, if you leave depression alone, it begins to feed on itself and it worsens over time. It's important to recognize negative thought patterns that contribute to feeling worse. Thoughts that are overly critical, shaming, need to stop. Yes, that is hard, but it's important to disrupt those negative thoughts, rephrase it, and practice it. You'll feel a little odd or even silly, but in time, you can force the brain to get off that hamster wheel of negative thinking where depression feeds itself. If you practice disrupting negative thoughts enough, you can cause the brain to choose a new neural pathway and begin processing information in a way that promotes healing. Another way to be proactive in fighting depression is to reach out to a support system. Depression wants you to isolate. Instead, practice reaching out to friends for support when depressive thoughts say, "I'd rather be alone." Try to spend a little bit of time doing the things that you once enjoyed. You must remember that it is not you that's causing those feelings of disinterest in formally pursued activities and people. It's depression. Practicing the concept of faking it until you make it is not just a feel-good approach to ease symptoms. It can literally contribute to a chemical and even structural change in the brain. The second concept is that with depression, it's healing to just focus on the basics. This means trying to stick to a routine and, of course, staying active, eat and sleep well. People who remain active and do what they can to fight against the urge to be inactive will have the most success. Evidence shows that even just a half hour of high-intensity cardiovascular exercise a week can have a huge impact on the neurological progress in depression healing. This is because exercise helps break down stress hormones while releasing feel-good hormones, the same ones that antidepressants can help with. You can also have a significant impact on the way your body and mind feel by eating well. When you're depressed, you'll want to avoid reaching for those sugary snacks that self-soothe. These usually come with a crash and can even contribute to inflammation, which can make you feel so much worse. It really is best to stick with a healthy balance of protein, fat, and produce to maintain your energy levels and help you feel balanced. It's important to stick to the basics, eat at normal times, and don't skip meals in order to fuel your brain. And of course, limiting the use of caffeine and alcohol. Depression and sleep go hand in hand. You just don't have the flexibility to lose out on sleep. Sleep helps restore the brain and get rid of toxins and is non-negotiable if you want to beat depression. If you had diabetes, you simply wouldn't have the flexibility to eat half a pizza and half a cake without serious medical consequences. Depression and sleep are the same way, and sticking to a consistent sleep schedule and getting enough of it should be high on your priority list. One last important thing to remember is to be kind to yourself. It's not your fault that you have depression. Show yourself compassion and be an ally to yourself, the kind that you would be to your best friend, especially on the days when you feel like nothing is working to help you feel better. And give yourself credit for every step in the right direction. It's the cumulative effect that makes the difference, and beating yourself up could delay your healing. Depression is treatable. Moving beyond depression isn't about willpower or mindset. So be kind to yourself and allow time to heal. Now, if this is something that you've been dealing with for a long time and feel like it's time to get some help, reach out to your mental health care specialist. And if you're in the Vancouver, Washington, or Portland, Oregon area, reach out to us. We know how hard it is to live day after day with depression. We've helped hundreds of patients overcome their depression, and we would love to help you if you're ready for it. Thank you for watching, and we'll see you on the next video.